Good afternoon, my dear students. So, this is the rationalization of what you have answered last meeting on the pre-board or a review. So, may I just share my screen? Okay. So, this is the first question. So, which of the following is the definition of gestational hypertension? First option, blood pressure over 160/95 millimeters mercury or rise of more than 30 millimeters mercury systolic or 15 mmHg diastolic over baseline. The second option, blood pressure over 140/90 mmHg or rise of more than 40 mmHg systolic or 25 mmHg diastolic over baseline. The third option, blood pressure over 130/85 mmHg or rise of more than 35 mmHg systolic or 20 mmHg diastolic over baseline. And the last option, blood pressure over 140/90 mmHg or rise of more than 30 mmHg systolic or 15 mmHg diastolic over baseline. So what is the right answer? So the right answer is blood pressure over 140/90 millimeters mercury or rise of more than 30 mmHg systolic or 15 mmHg diastolic over baseline. So what is the explanation for this? So gestational hypertension is defined as a blood pressure over 140/90, that is millimeters mercury, or a rise of more than 30 mmHg systolic or 15 mmHg diastolic over baseline. So it is generally develops after week 20 of pregnancy and returns to normal after delivery. So there are also types of hypertension that we have already learned during the past semester, right, my dear students? So we have here the chronic hypertension. So when we speak about chronic hypertension, that is hypertension or the high blood pressure which is present prior to pregnancy. So bago pa lang siya nagbuntis, meron na siyang high blood. Another one, we have chronic hypertension which was superimposed preeclampsia. So ano naman ang ibig sabihin nito? So preeclampsia which develops in someone who has chronic hypertension or high blood pressure before pregnancy. So another one, so yung ano natin, topic natin ngayon on the question number 1. So gestational hypertension. So high blood pressure is noted in the later part of pregnancy. So week 20, right? But no other signs of or symptoms of preeclampsia are present. So some women will later develop preeclampsia while others probably have high blood pressure or chronic hypertension before pregnancy. And of course, another type of hypertension in pregnancy is the pre-eclampsia. So this one is fatal, most especially kapag naging eclampsia na siya. So this one is a condition only found in the later half of pregnancy. And the result in hypertension, there is protein in the urine, and generalized swelling in the mother or what we call the edema. So not only bipedal edema, sometimes when it progresses, it becomes your anasarca, or the whole body will now have to swell or have edema from head to toe. Okay, so it can impact other organs in the body and also cause seizures. So, meron na siyang seizures. Next, we have question number 2. Fundal height of a woman is measured from what? Blank. So, the middle of the pubic bone to the top of the uterus. Is it option 1 or option, the first option? The second one, the top of the pubic bone to the middle of the uterus. Another option, the bottom of the pubic bone to the top of the uterus. Another option is the top of the pubic bone to the top of the uterus. And the last option is the middle of the pubic bone to the bottom of the uterus. So what is the answer? So the correct answer is what? The top of the pubic bone to the top of the uterus. So we are going to measure in that part. So as you see in the illustration, this one, so the top of the pondus and the top of the pubic bone. So fundal height, sometimes referred to as the McDonald's roll. So is measured in centimeters from top to the pubic bone to the top of the uterus. So the top of the uterus may also be called the fundus of the uterus. Ito siya dito. And it is used to assess the growth and development of the fetus inside the womb. So as it becomes bigger, of course, meaning the baby is also growing inside the uterus. Okay, let's go now to question number 3. Alex is 17 weeks pregnant. She comes into the clinic to get an alpha-fetoprotein test. A low result could indicate all of the following except blank. So what is this? Preeclampsia? Is it preeclampsia? Another option, the gestational age of the baby is incorrect. Another one, fetal trisomy 21. Another one, fetal trisomy 18. And the last option, hyatidiform mole. Okay, so what is the answer? So the correct answer for this is what? It is preeclampsia. So what is the explanation for this? Alpha-fetoprotein is made by the feto. So yung bata sa loob, siya yung gumagawa ng alpha-fetoprotein. So congenital abnormalities, fetal trisomy 18, fetal trisomy 21, o yung kapag ito yung tinatawag natin na mongoloid. So are associated with levels of this protein. So additionally, so it is hyatidiform mole. Hyatidiform mole is the presence of abnormal mass or growth inside the uterus. Diba? Based on a low result, the physician may want to conduct further testing of this. So preeclampsia is a dangerous medical condition characterized by high blood pressure. Okay, it is not associated with alpha-fetoprotein. So the right answer is preeclampsia. Let's go now to question number 4. So midwife Mindel is assessing a woman in labor. So she knows that fetal bradycardia occurs when heart rate drops into 90 beats per minute. Another option, 100 beats per minute. Another option, 110 beats per minute. Next option, 130 beats per minute. So what is the right answer? The right answer would be 110 beats per minute. Why? Bakit kaya ito yung sagot niya? Because fetal bradycardia is recognized when fetal heart rate drops below 110. So we all know that the normal fetal heart tone is 120 to 160 beats per minute, right? So this one, pag nag-drop siya into 110, ayan, abnormal na siya. So the normal fetal heart rate is between 120 to 160 beats per minutes. So fetal tachycardia also is a heart rate above 160 beats per minute. So nagkakaroon na ng tachycardia if more than 160 beats per minute yung kanyang heart rate. Kapag below naman 120, 110, and etc., that is already fetal bradycardia. Okay? Let's move on to question number 5. Romelia, a 32-year-old woman, presents her first prenatal visit. So the doctor orders a CBC complete blood count. So which of the following is not included in the CBC? Is it hematocrit, platelets, hemoglobin, blood type, or white blood cell? Okay, so the right answer is, of course, I think everybody of you have experienced already this one checking of the complete blood count. So the right answer would be blood type because hematocrit, platelets, and white blood cells are composition of the test complete blood count. So a separate test called a type and screen is done for your blood type, isn't it? So cross-matching and screening should be done when they are going to extract or get a sample of blood when you donate, right? So that is the right answer. So complete blood counts typically contain hemoglobin and hematocrit, platelet counts, white blood cell counts, and red blood cell counts, among many other measures. So they are among the most frequently ordered laboratory tests for providers. So the physician will use this information to diagnose conditions such as anemia, or there is a blood loss when you assess the patient and the patient is very pale or cyanotic or whatever. So the doctor, the initial test to be done in the ER or any of the clinics is that you have to undergo the CBC or complete blood count. Okay? Next, question number 6. Benaran is assessing fetal heart rate in a pregnant patient. So the nurse record or the midwife record a pulse of 82 beats per minute. The midwife should try another Doppler device, add lubricant to the Doppler surface, call the physician immediately, ask the mother to lay on her right side, or move the Doppler. So the correct answer is, of course, you are going to move the Doppler. Okay, move the Doppler device. Why? Okay, because an 82 beats per minute reading could be the mother's heart rate. So baka yung nakuha mo yung sa kay nanay. Kasi hindi mo nilagay sa tamang lalagyan yung inyong Doppler or stethoscope. Okay, so it's indicate the nurse that does not have the Doppler in the correct position, di ba? So a normal fetal heart rate is between 120 to 160, di ba? So as we have learned, yun dapat ang fetal heart rate ng bata. Kasi kung mas mababa, masyado namang mababa yung 82, so you try to assess better by moving the Doppler device. Okay, you look for where you can locate, most especially you can get it in the fetal back. Okay, let's move on to question number 7. Charisse is 40 weeks pregnant and calls because she is seeking pink pins discharge for the first time. The midwife should tell to Charisse to blank. Okay. Lie on her back and place her feet in the air until help arrives. Call an ambulance. Continue to monitor. Drive to the hospital immediately. Nay, saan na tayo? Or eat a bland diet and continue regular exercise. So what is the answer? The answer for this is continue to monitor. Why? Because it's already 40 weeks. Maybe it's time for her now to deliver her baby. It is most likely this one is blood tints. That is already what we call the blood issue, right? So the blood issue on the beginning of labor. So there is no need to immediately arrive at the hospital, change the position, or eat bland diet. So the patient should continue to monitor and call back or seek care when she experiences regular contractions that are becoming more intense and frequent. Okay, let's move on to question number 8. Vina, who is 20 weeks pregnant, calls the clinic because she is experiencing pink tinge discharge for the first time. Oh, remember this one. Vina is only 20 weeks, okay? So the midwife should advise the patient to what? Call back if she experiences an increase in pelvic pressure. Another one, seek medical attention immediately. Another one, decrease her activity level. Another one, all back and symptoms have not subsided in 24 hours, or make an appointment to be seen tomorrow. Okay, so what is the answer for this? Okay, it's already 20 weeks and there is a pink tinge discharge. Is this normal or abnormal? So, according to the option, the right answer for this is seek medical attention immediately. Why? Because this woman could be experiencing preterm labor. So, at 20 weeks pregnant or pregnancy is not considered viable. So, di ba? Ano ba ang age of viability? It is 24 weeks, right? So hindi pa mabubuhay 'yan kasi 20 weeks pa lang, 'di ba? So she should be seen immediately to determine if there is a cause such as cervical insufficiency or premature dilatation of the cervix. Baka naman po open na yung kanyang cervix. It cannot hold already the fetus inside. So baka magkakaroon na ng premature labor and eventually the baby now will come out. So kailangan na lang mag-seek ng doctor's attention. Okay? So magche-check up na siya. Let's move on to question number 9. Trisha is a 21-year-old woman who is presenting at the emergency room for severe vaginal bleeding. She is 32 weeks pregnant. Upon further examination, she is found to be suffering from abruptio placenta. Okay? Which of the following assessment findings would be at least concern to the midwife? The first option, shortness of breath. Another option, bleeding from the oral mucosa. Another option is small red dots on the skin. Another option, a tender uterus. And the last option, decreasing blood pressure. Okay, so what would be the right answer? A tender uterus. Okay, why is it that it is the tender uterus? So, abruptio placenta is a serious condition, right? So, magkakaroon na yan ng bleeding kasi abruptio placenta. So, abruptio placenta is a serious condition where the placenta inappropriately and prematurely detaches from the uterus. So, madedetach na yan in the uterus. Okay, so 32 weeks pregnant pa lang si Mother Trisha. So, woman with obstetric complications such as abruptio placenta can quickly develop disseminated intravascular coagulation. So, anong ibig sabihin yan? Magkakaroon ng bleeding. Talagang magkakaroon ng malaki yung too much bleeding kasi disseminated intravascular coagulation yan. So DIC is a clotting disorder in which the blood inappropriately clots. Hindi siya nagkakaroon ng clots kaya nagdudurugo yung mother, di ba? So severe bleeding can also occur as clotting proteins become scars. Okay? So symptoms of the IC includes kapag makita mo na yung mother na ito yung mga symptoms niya, blood clots, the bleeding into the tissues as the skin and oral mucosa. Yan, makikita mo na talaga, nagpipil na yung mother, di ba? A decreasing blood pressure. Oh, if you are going to check the BP of the patient, there's a sudden drop of the blood pressure of the patient. And then, severe bleeding is coming out to the vagina by this one, a combination of DIC and abruptio placenta is very fatal o nakakamatay na sa mother, di ba? There is also shortness of breath. So if you are going to get the pulse oximeter and get the oxygen saturation of the mother, is starting to drop down into, di ba, ang normal autosat ng mother is 95 to 100% sana. So magiging below 95 na yung kanyang oxygen saturation. Ayan, kapag ano na. So kailangan na mag-administer ng oxygen per doctor's order. So those are the indications na meron na siyang DIC because nagkaroon ng ng abruptio placenta. So shortness of breath could indicate a presence of a blood clot. Okay? So although the uterine tenderness is of concern, so it is common, abruptio placenta and does not indicate an immediate life-threatening condition. So in your options there, so the right answer is a tender uterus. Okay, question number 10. Okay, in question number 10, the midwife helps the healthcare team to deliver a healthy baby girl. Upon delivery of the placenta, the midwife notices that it is not 100% intact. Okay? What is the midwife first concern? Pulmonary embolism, deep vein thrombosis, hemorrhage, or tissue perfusion, or infection? What do you think is the right answer? Bokya, it's a hemorrhage. So why hemorrhage? Because if the placenta is not whole upon delivery, a piece may still be present in the uterus. O di ba? Kapag di ba ang first action mo kapag lumabas na yung placenta, you have to count the number of cotyledons. Okay, bilangin mo ano ba ang normal na placenta, di ba? It's 15 to 20 cotyledons. And then there's a rough phase. Tingnan mo. Ano ba ang itsura niyan? Okay, you have to check. Ada ba napirgis? Kasi so, if there are retained placenta, magkakaroon na ng hemorrhage. So, this inhibits the ability of the uterus to shrink in size and may cause hemorrhage. So, the missing piece needs to be located immediately. Kailangan mo nang hanapin yung natirang piece of the placenta. Okay? So, here's the image of your placenta, cotyledons. Okay, so it is dull grayish red in color and is divided into 15 to 20 cotyledons. Each cotyledons is performed of the branches of the main villus stem covered by the decidua basalis. Let's move on to question number 11. While monitoring a laboring patient, the midwife notices that the fetal heart rate at baseline varies from 110 to 145 beats per minute. The midwife first action would be which of the following? So decrease IV fluids. No action is required. Turn the mother on her left side. Have a mother bear down or administer oxygen at 1 liter or 1 liter per minute via nasal cannula. What is the answer? The answer for this would be turn the mother on her left side. Bakit naman dun sa left side? Okay? So, ano ang explanation nito? Mark the fetal heart baseline variability of 25 beats per minute or move may be cause for concern. So, cause for concern na natin yun. Similar findings may indicate there is a poor oxygenation to the fetus. So, turn the mother to her left side to increase perfusion and notify the physician. So note that this is still in the normal range for fetal heart rate for a laboring patient, about 30 beats per minute. Okay? And that the low end of the spectrum is slightly more concerned. Okay? So we have to position really the mother into the left side position, 'di ba? Yung heart natin nasa left side. So in order to have a better circulation of blood, so yung blood natin, yung blood ng mother I should say, ayan, in order to supply more to the baby, dapat ano siya sa position na yan. So, left side lying position. Okay? Question number 12. Andrea comes to the office for a prenatal visit. She mentions that lately she has been excessively hungry, thirsty, and very tired. While which of the following would the nurse or midwife suspect? Preeclampsia, anemia, parvovirus B19, toxoplasmosis, or gestational diabetes. So we have learned this. I have explained this already to you last semester. The three P's of your gestational diabetes. So the answer for this one is gestational diabetes. Ano ba yung three P's natin sa gestational diabetes? We have polyphagia, polyuria, and polydipsia, or increase in what? For excessive hunger, that is polyphagia. For excessive thirsty, polydipsia, and polyuria, excessive urination. So, yon. Dapat alam nyo yon. So, all these three I assign that the mother have already gestational diabetes. While increase in fatigue is common in pregnancy, yes, I have experienced also that one. Really you need more energy because you are carrying a baby, and two of you and the baby is using oxygen and energy. Okay, so preeclampsia involves elevated blood pressure, swelling of the hands and feet, and protein in the urine. Toxoplasmosis naman is the result from the infection by a parasite and can affect fetal development. Okay? And amniocentesis is performed to diagnose the, what do you call this one? Gestational age, right? And drugs may be administered to decrease the chance of parasite from the infecting the fetus. So anemia and parvovirus B19 are unlikely to cause all three of these symptoms occurring together. So wala silang pakialam doon sa lumabas na signs na hungry, thirsty, and very tired. So ang tamang sagot ay gestational diabetes. Let's move on now to question number 13. All of the following may trigger asthma in a pregnant woman except what? Animal dander, esophageal reflux, unwashed sheets, stress, or moist air. So what is the right answer? The right answer is, of course, moist air. Why? Because all of the one that is listed here, animal dander, esophageal reflux, unwashed sheets, and stress may trigger an asthma. Okay? Additional, may I also add smoke, illness, molds, exercise, respiratory illnesses can also trigger asthma. Okay? Let's move on to question number 14. A 24-year-old primigravida client has just given birth to an Rh positive child and she herself is Rh negative. The midwife recognizes this situation that can lead to future problems in terms of future pregnancies due to this blood type mismatch. All of the following are associated with Rh factor incompatibility except. First option, a major effect of Rh incompatibility is an increased risk of blood clottings and thrombosis in the fetus during subsequent pregnancies. May lead to fetal anemia and lead to an acceleration of red blood cells cell production if the mother is not given ROD immune globulin to prevent antibodies from destroying fetal blood cells. The mother will form IgG and IgM or immunoglobulin G and immunoglobulin M antibodies in response for being exposed to a fetus incomplete blood type. The mixing of fetal blood, the mixing of the what do you call this one? The mixing of fetal blood with maternal blood may occur during an amniocentesis or early separation of the placenta during birth. Kernicterus is a potentially serious effect due to pathological jaundice that can have long-lasting neurological effects on the child if not prevented. Okay, so what is the answer? For the answer for this is a major effect of Rh incompatibilities increased risk of blood clotting and thrombosis in the fetus during subsequent pregnancies. Why? Bakit kaya ito yung sagot? Because blood clots are not a common effects in the fetus due to Rh incompatibility. Okay? So a disorder known as erythroblastosis fetalis is a type of hemolytic disease that occurs in the fetus due to immune reaction into Rh negative. To take note of that, Rh negative mother and the Rh positive fetus. Okay, all other choices are associated with these types of incompatibility. Okay, let's move on to question number 15. Which type of abortion is associated with sepsis or cramping? Sepsis, cramping, abdominal tenderness, and open cervical opening. Is it missed abortion? Is it inevitable abortion? Is it spontaneous abortion? Is it complete abortion or threatened abortion? Okay, so what is the correct answer? It is missed abortion. Why is it that it is missed abortion? Because a missed abortion is marked by what? By the death of a fetus in utero, but it's not expelled from the uterus. If left untreated, it can lead to infection in the womb, right? And it is marked by foul odor and bleeding as well as elevated temperature and sepsis. Okay, so that is the right answer. Let's move on to question number 16. Which of the following statement is true about a hiatus molar pregnancy? An ultrasound usually reveals a mass resembling a cluster grapes, and a blood test will reveal a positive pregnancy result due to elevated HCG human chorionic gonadotropin hormone. The cause of a molar pregnancy is due multiple ovum becoming fertilized and coalescing to form a cluster of atypical cell containing a haploid number of chromosomes. A molar pregnancy is a type of ectopic pregnancy in need of dilation and curettage to prevent internal hemorrhaging or possible hysterectomy. A molar pregnancy can proceed without incidence once ROD immune globulin is administered to the mother. And a hiatidiform molar pregnancy is reported to cause malignancy in appropriately 60% of cases. What is the correct answer for this? It is an ultrasound usually reveals a mass resembling a cluster grapes, and a blood test will reveal a positive pregnancy result due to elevated HCG or human chorionic gonadotropin hormone. Why? Bakit kaya ito yung sagot? Because a high TD4 molar pregnancy is mostly benign, di ba? Benign process that may occur during an abnormal ovum becoming fertilized and growing into collection of cells in a cluster-like formation. So, radyo ko na yung grapes, meron siyang grapes na buntis. Yung mga sinasabi nila noon na about yung sa superstitious belief, right? So, they are benign over 80% of the time. And ROD, immune globulin, is a medication administered to a negative mother and that will give birth to a second Rh positive child to prevent an immune reaction that may harm the child. Let's move on to question. Before that, we have here the explanation of the ROD. So, ROD, immune globulin, is a medication used to prevent Rhd isoimmunization in mothers who are Rhd negative and to treat idiopathic thrombocytopenic purpura in people who are Rh positive. It is often given both during and following pregnancy. It also may also be used when Rhd negative people are given Rhd positive blood. Then RHOD, immune globulin, is used to treat immune thrombocytopenic purpura, or what we call the ITP, in patient with Rh positive blood. ITP is a type of blood disorder where the person has a very low number of platelets. So platelets help to clot the blood. RHOD, immune globulin, is also used to prevent antibodies from forming after a person with Rh negative blood receives a transfusion with Rh positive blood, or during pregnancy when a mother has Rh negative blood and the baby is Rh positive. It belongs to a group of medicines called immunizing agents. So, ROD, immune globulin, works to boost the immune system and prevent excessive bleeding. The Rh factor is one part of the red blood cells. A person has either Rh positive or Rh negative blood. So if you receive the opposite type of blood, the body will create antibodies that can destroy the red blood cells. When a pregnant woman is Rh negative and her baby is Rh positive, the baby's blood can get into her system and cause her to make antibodies. When the same woman has a second baby with Rh positive blood, the antibodies will destroy the red blood cells in the baby. So, rowdy immune globulin is given to this woman during pregnancy or after delivery to prevent them from making antibodies. Okay, so that the next baby, hindi na siya affected. Okay? Kaya nag-i-inject sila ng ganyan. Okay, let's move on now to the next question, number 17. Okay. So in question number 17, a woman is hospitalized for preeclampsia. Which medication may the nurse or midwife administer to prevent the occurrence of seizures? Novain, magnesium sulfate, sulfidem, calcium gluconate, or pitocin? What is the right answer? The right answer for this is your favorite, magnesium sulfate. So magnesium sulfate is used to prevent what? Seizure. So they are preventing seizure in women with severe preeclampsia. How about calcium gluconate? Calcium gluconate is the antidote for magnesium toxicity. And pitocin naman is used to stimulate the uterus open to induce labor. And novain, yung novain naman is an opioid analgesic. So this is a pain reliever, a painkiller. So sulpidam naman is it will help to sleep. Pampatulog yan, sulpidem. Okay. Moving on to the next question. Number 18, Trina. The midwife is 29 years old and experiences bleeding between periods. The midwife marks which of the following on Trina's medical chart? It is menometrorrhagia, polymenorrhagia, menorrhagia, oligomenorrhagia, or metrorrhagia. The right answer is metrorrhagia, the last option. So metrorrhagia is bleeding between periods. So menorrhagia naman refers to the excessively heavy periods. Oligomenorrhea naman refers to light scattered periods. Kunti-kunti lang, parang spotting siya. Okay? And polymenorrhea naman, polymenorrhea naman is used to describe short cycles equal to or less than 21 days. And metrorrhagia naman is used to describe periods that are heavier, sporadic, and frequent than normal periods. So the right answer is metrorrhagia. Moving on to question number 19. A patient tells the nurse or midwife that she is practicing fertility awareness. The midwife tells the patient that the unsafe period can range from what? Blank. 7 days before and 7 days after ovulation. Another one day before and 1 day after ovulation. Another one, 2 days before and 1 day after ovulation. Another one, 2 days before and 2 days after ovulation. And the last one, 1 day before and 2 days after ovulation. What is the answer? Of course, the first option. 7 days before and 7 days after ovulation. So according to the family planning method of contraception, the period in which conception can occur and one should refrain from intercourse is 7 days before and 7 days after ovulation. Okay? Some references also show that sperm can live up to 5 to 7 days inside the female reproductive system. So, wag magkampante ha. Yan, nabubuhay pa rin ang sperm sa ganong katagal. And an unfertilized egg can live between 12 to 24 hours. So, this greatly increase the window in which the conception can occur. So, take note of that. Okay. Moving on to question number 20. Which of the following is false regarding oral contraceptives? They may decrease the risk of breast cancer. They may increase the risk of developing a blood clot. They may heighten the risk of depression. They may decrease the severity of menstrual cramps, or they may reduce the risk for uterine cancer. What is the right answer for this? Of course, they may decrease the risk for breast cancer. So it is false. All of those remaining options are true. The first option is false. So oral contraceptives may increase the risk of breast cancer. Okay? Increase the risk of depression also. And may increase also of the developing blood clots in women who smokes, and they can reduce the risk of uterine cancer and frequently used in women with primary dysmenorrhea. So primary dysmenorrhea refers to painful menstrual cycle without an underlying cause. Moving on to question number 21. Your patient is under 24 hours fetal monitoring and observation. The fetal monitoring strip begins to show deceleration starting after the peak of contractions and recovering late. Which of the following intervention does the midwife anticipate doing? Increase rate of oxytocin, administer medication, removing oxygen supplementation, repositioning the mother, or fluid bolus with normal saline solution. The answer for this is reposition the mother. Again, so we have this already to increase the circulation, for better circulation, for better uteroplacental blood flow, we have to reposition the mother into the left side. Next, let's move on to question number 22. In a fetus position at left occiput anterior, where should the midwife assess the fetal heart rate? Below the umbilicus on mother's left side, above the umbilicus on mother's left side, above the umbilicus on mother's right side, at the level of umbilicus, or below umbilicus on mother's left side. The correct answer for this is below the umbilicus on the mother's left side. Why? Because when considering where to hear the fetal heart rate best, kung saan yung pinakamagandang position, the midwife must consider the location of the fetal box. So using the Leopold's maneuver, we can locate where is the fetal box. So if you are done locating the fetal box, doon mo ilalagay yung what? Stethoscope o yung Doppler. So it is where you can locate better the what do you call this one? The fetal heart tone. Okay, ito yung kanyang itsura kung saan we can put on or locate using the stethoscope or the Doppler. Okay, moving on to question 23. Up to 90% of cases of pelvic inflammatory disease have what etiology? Is it Neisseria gonorrhea and Chlamydia trachomatis? Is it Chlamydia trachomatis only, human papilloma virus only, or Neisseria gonorrhea only? The right answer for this is the first option, Neisseria gonorrhea and Chlamydia trachomatis. Why? Because 75% to 90% of all cases of pelvic inflammatory disease are caused by Neisseria, gonorrhea, and Chlamydia trachomatis infection. Okay, this condition is defined by adhesions, formation in the uterus. The fallopian tubes can result in serious issues such as infertility. Bakit kaya hindi siya nanganak? Kasi ito yung nagkaroon siya ng ganito before, because it will cause infertility. Another one, ectopic pregnancy and reproductive cancer. So yung sa ectopic pregnancy naman, baka hindi siya nakakabuo siya, pero doon siya sa hindi siya umaabot sa ampulla. Doon lang siya sa fallopian tube outside. So, 'di ba, alam naman natin na kapag doon lang pagka 3 months na puputok na 'yan. So, dapat rin malaman natin ng mas maaga para maagapan at hindi magkaroon ng mas grabeng epekto. Okay? Moving on to question number 24. What would be the primary concern in the case of rubella infection during pregnancy? Is it gestational diabetes? Is it maternal deaths? Is it birth defects or maternal ocular damage. What is your answer? The answer is what? Birth defects. Most especially if it happens on the first 3 months or what we call the first trimester, it will really cause a very serious birth defects. Okay. And for the last question, at what time during gestation is a fetus most susceptible to congenital rubella syndrome? Is it week 30 to week 40, week 20 to week 30, week 12 to 20, or the first 12 weeks after conception? The right answer for this is the last option, which is the first 12 weeks after conception, because it is where the organs of the baby are being developed. On the first 3 months, doon nade-develop lahat ng kanyang organ. So, kailangan hindi siya magkaroon ng rubella for the first 3 months. Okay? So, that's all. Those are the rationale of your pre-board or review posted and answered by a Google form. I hope you understand well, and please, you can watch and watch so that may mag-remain para ready na tayo para sa board exam. Salamat!